Hello and welcome back, my dear students of class 12, with me, your tutor Rebecca, to this psychology class. Today we will be learning and discussing a new chapter, that is chapter 6, psychological disorder, from your syllabus, and unit 4 from your psychology textbook, page number 69 of your psychology textbook. Now in this chapter, after learning this chapter, we would be able to understand the basic issues in abnormal behavior, the classification, the criteria used to identify abnormal behavior, and the factors which cause abnormal behavior and the major psychological disorders. Now, when I say psychological disorders, I'm sure that you might have got the idea that it is something related to mental disorders, right? Now, so what is these psychological disorders? Psychological disorders basically means conditions characterized by abnormal behavior, abnormal feelings, thoughts, and behavior, okay? So in order to understand abnormal behavior, it is essential to first understand what do we mean by the term abnormal. So abnormal behavior means deviation from what is expected and normal. It means unusual behavior that is different from the norm, or that does not conform to social expectations. Now, abnormal behavior has been defined as a psychological dysfunctions which causes distress or impaired functioning and deviates from typical or expected behavior according to societal or cultural standards. Now, most of these definitions has four common features, often called as 4Ds. The first one is deviance, distress, dysfunction, and dangerous or danger. Now, what is this deviance? Deviance means something that is different, that is extreme or bizarre. It indicates a move away from what is normal, a behavior that is unusual. Now, when a person is said to be a deviant, he or she fails to follow the stated or unstated rules of society called as social norms. So deviance basically means a behavior that is unusual. Now, second, distress. Distress basically means unpleasant or upsetting to the person and to the others as well. Dysfunction means inability to carry out the normal things, the normal tasks that we used to do every day, our daily life activities, in a constructive manner. These functions refers to the breakdown of disturbance of cognitions, emotion, and or behavior, okay? And the last one is danger. Now, when we say danger or hear the word danger, we can easily make out that something that is likely to cause harm or injury to self or to others. Now, dangerous refers to when a behavior that represents a threat to the person, to the safety of the person or to others. So these are the 4Ds that these are the 4Ds of abnormal behavior. Now, if these 4Ds are present, then obviously we will consider the particular person as abnormality. Now, there are some various approaches that have been used to distinguish between normal and abnormal behavior, okay? And from these approaches, there emerged two basic and conflicting views. The first approach view abnormal behavior as a deviation from social norms. Now, many psychologists have stated that abnormal is simply a label that is given to a behavior which is away from the social expectation. Now, every society has social norms, it has which has a stated or unstated rules for proper conduct. So the behavior thoughts and emotions that breaks any societal norms are called as abnormal behavior. Now, the second approach views abnormal behavior as maladaptive. Okay. Now, when we talk about abnormal behavior, we say a person is not just working for his growth and survival, but also for his fulfillment, for his self-actualization, which Maslow theory talks about. So here we are not just talking about the aspect of the people who is able to cure himself from the problems or certain problems, but we are talking about the person who is able to maintain his well-being as well. So according to this view, conforming behavior can be seen as abnormal if it is maladaptive. That is, if it interferes with optimal functioning and growth. Now, one major concern that we have related to abnormality is stigma associated with it. Now, the stigma attached to mental illness means people are hesitant to consult a doctor or a psychologist because they are ashamed of their problems. Thinking about what people will say, this person is mad, crazy, or lunatic, but that's not the case. It's just that you are stuck somewhere, you are facing some problems and discomfort, and so you are going to a specialist to take some help who are expert in this field. Now the next topic is historical background of psychological disorder. Now, in order to understand the psychological disorders, we would require a brief account, the historical account of how these psychological disorders has been viewed over the ages. Now, one ancient theory that is still encountered even today holds that abnormal behavior can be explained by the operation of supernatural and magical forces such as evil spirits or the devil. And in societies that believe in this theory, therapy generally involves exorcism, that is, removing the evil spirits that resides in the individual through counter magic, and magic that is used to protect against a spell or enchantment, and prayer. So during this time, in many societies, shaman or medicine men are called because they are believed to communicate with the supernatural forces and is the medium through which spirits communicate with the human beings. So through shamans, an afflicted person and a troubled person can learn which spirits are responsible for his or her problems and what needs to be done to cure themselves. A recurring theme in the history of abnormal behavior is the belief that individuals have behaved strangely because their bodies and their brains are not working together. So this is the biological and organic approach. Another approach to the causes of abnormal behavior is the psychological perspective. Now, according to this view, behavioral disturbances are caused by lacking or inability in the way an individual thinks, feels, or perceives the world. They view that people are at least potentially capable of examining their own thinking and modifying their behavior. So all these three aspects, the perspective that is supernatural, biological, and psychological, have appeared throughout the history of Western civilization. Now, in ancient Greece, disturbed behavior was originally interpreted as punishment for offenses against the gods. Now, in the ancient Western world, it was philosopher, a physician of ancient Greece, such as Hippocrates, Socrates, and in particular Plato, believed that who developed the orgasmic approach and viewed disturbed behavior as rising out of conflicts between emotion and reason. Now, in his laws, Plato expressed the belief that people who have lost this reason should be separated from the community, from the society. His belief was similar to that of the in the past society. However, as time went on, separation of the mentally ill person from others in the community became the responsibility of the government rather than of the family. Another important person, another great Greek philosopher, a physician, named as Galen, consolidated and augmented the Greek theories of mind and body. He thought that psychological characteristics were expression of bodily process influenced by a balance of the four humors. According to him, the material world is made up of four elements, namely earth, air, fire, and water, which combine to form four essential bodily fluids, that is blood, black bile, yellow bile, and phlegm. Now, this blood it promotes a feeling of joy, optimism, enthusiasm, affection, and well-being, and it is red in color. Flame induces passivity, devotion, emotionalism, and sensitivity. Yellow bile represents provokes, excite, and emboldens the patient. It provokes the anger, irritability, envy, jealousy, and courage. It is slightish yellowish tint in color. Now, the fourth one is black bile. It is melancholic humor. It is a melancholic humor and is present as a brownish gray in color. It is the last to arise and it encourages prudence, realism, and pessimism. So each of these fluids seem to be responsible for a different nature and imbalances among the humors which believed to cause abnormal behavior. So that was in ancient period. Now the Greeks were the first to study mental illness scientifically and systematically and separate the study of mind from religion. Now Aristotle, a Greek philosopher, emphasized on the release of repressed emotion. For the effective treatment of mental disorders, he suggested a catharsis, a process releasing a strong or repressed emotion, and music therapy for the patient with melancholic, the black bile, for the patient who are suffering from extreme sadness or depression. Now, in the Middle Ages, demonology and superstitions gained renewed importance in the explanation of abnormal behavior. Now, people with these mental disorders in this period were considered as evil, and there are numerous witch hunt during this period. One of the great focus during this time was Saint Augustine, who believed that although God is acted directly to human affairs, people are responsible for their own actions. He wrote extensively about feelings, mental pain, torture, and conflict. And he laid the groundwork for modern psychodynamic theories of abnormal behavior. Now, a period called the Renaissance period was marked by increased humanism and curiosity about behavior. John Weyer, a Dutch physician, occultist, and demonologist, was one of the first to establish against the persecution of witches. He insisted that witches are mentally disturbed and required medical conditions and no such theological treatment to to look after the mentally ill person. During the 17th to 18th century, the period known as the Age of Reason and Enlightenment replaced faith and the principles, the dogma in scientific method as ways of understanding human behavior. Right? Now, the growth of this scientific method towards psychological disorders in 18th century contributed to the reform movement to increase compassion for people who is suffering from these disorders. During this period, mentally ill persons were not considered as outcasts. They are not rejected, but they were considered as people who need help. Mental asylums were improved and were initiated in both Europe and America. And one of the most important aspects of reform movement was the new inclination for deinstitutionalization. Means mentally ill people were taken back to their families from the public institution, which placed emphasis on providing community care for mentally ill person. So there has been a convergence of this process, approaches, which has resulted in an interactional on biopsycho-social approach. From this perspective, all these three factors, that is biological, psychological, social, plays an important role in influencing the expression and outcome of psychological disorder. So that was the historical background of psychological disorders. Now the next topic is factors causing abnormal behavior. Now, in order to understand abnormal behavior, psychologists use different approaches, and each approach emphasizes a different aspect of human behavior and explain and treats abnormality with that aspect. These approaches also emphasize the role of different factors that cause abnormal behavior, such as biological, psychological, and social factors, social cultural factors. Now, the first factor is biological factors. Biological factors such as genetic defects and inherited medical conditions caused by DNA abnormalities such as Down syndrome, malnutrition, lack of sufficient nutrients in the body, injuries, body dysfunction, and physical deprivation interfering with normal functioning, with normal development of the human body can cause abnormal behavior. Now, these biological researchers have found that psychological disorders are often related to problems in the transmission of messages from one neuron to another neuron. So when an electrical impulses reaches a neuron's ending, the nerve ending is stimulated to release a chemical called neurotransmitter. Now, studies have shown that abnormal behavior activity by certain neurotransmitter can lead to specific psychological disorders. Now, low activity of the neurotransmitter can link to anxiety disorders by GABA, that is gamma aminobutyric acid, and schizophrenia to excess activity of dopamine, and depression to low activity of serotonin. So on the other hand, genetic factors have also been linked to mood disorders, schizophrenia, mental retardation, and other psychological disorders. So from here, on this note, I would like to wind up the class. In the next class, we will be continuing with the same chapter. Thank you all for joining me.